Our demographic is almost 79% alcohol now, compared to 21% combined everything else.
Alcohol poisoning can lead to brain damage or even a coma or even death. If actually any one of these things is occurring, that's when you call 911. Puking repeatedly, you are unresponsive. If respiration is slow, so fewer than 8 breaths per minute, if the skin is pale, blue, or cold.
You can sort of tell if the person is fitting into these boxes, if this is a situation where you need to call 911, you need to get them to the hospital.
I can just recall situations where, yeah, people were unresponsive. Everyone wants to be, oh, they'll be fine. And yeah, sometimes they're not.
This is not don't stop drinking, or, on your own. We want everybody to quit drinking, but we just want you to be able to do it in a safe and controlled environment. Doing it on your own or cold turkey is really, it can be kind of dangerous.
You just really want to think, be mindful of, the person, the setting that they're trying to detox in, and not pushing someone to just get better, just stop drinking. There's dangers here. And so you need to, be mindful of that and help kind of make a plan to get them in a safe environment so they can come off alcohol safely.
All right. Welcome back to the show, Tom.
Yeah. Thank you for having me. What are we talking about today?
Well, what's been coming up a lot, and I think people are consistently surprised when I talk about our demographic at Elevate, the people that we're seeing coming in the program. And just as a quick little aside, so because we do outcome studies, so we're always monitoring this stuff. So back in 2019, our demographic was 51% of the people were here for all drugs combined, meth, pot, prescriptions, you name it, fell in that 51% bucket. 49% was alcohol, which is still, that's a lot. That's like half our demographic. Well, fast forward 4 years, 2024, and it skyrocketed in 22, but now we're seeing the numbers in 24 and 25. Our demographic is almost 79% alcohol now, compared to 21% combined everything else. And that's with fentanyl and kratom and nitrous and all the things that we talk about. They only comprise a small amount of our demographic. And that's due in large part because so many people are consuming alcohol from every single age, from 14 years old to 80 years old. We're seeing it all over the place. So I felt like alcohol was a really important subject for us to talk about today.
I think specifically we wanted to talk a little bit about alcohol poisoning and the detox dangers of alcohol too.
Absolutely.
That's going to be definitely a good topic and educational for a lot of people.
So let's get right into it. Let's talk about, when should a family be concerned if the person or the loved one that they're with is actually suffering from poisoning from alcohol, or they're just drunk? How do they know?
Alcohol poisoning occurs when a person consumes a toxic amount of alcohol over a short period of time. So alcohol, what it does is a central nervous system depressant, and a excessive intake of alcohol shuts down basic life functions, including breathing and heart rate. And, if left untreated, alcohol poisoning can lead to brain damage or even a coma or even death in some cases.
I can see how it's confusing for people if they're looking at their loved one. They're just drunk, they're just passed out, put them in bed, lay them on their side, they'll be fine in the morning. But when there's that level of toxicity, there is very real dangers that this person could actually die. There is actually an acronym that I think is very helpful for the families or loved ones, or really anyone, for you to be able to sort of, if you could recall this acronym, you can sort of tell if the person is fitting into these boxes, to be able to tell if this is a situation where you need to call 911, you need to get them to the hospital, or that type of thing. So this acronym is P.U.R.S, P.U.R.S.
P.U.R.S, yeah. And so the P stands for puking. So, puking repeatedly, even while passed out in some cases. And so any sort of vomiting when it comes to drinking alcohol usually means there's a certain level of toxicity, like the body is trying to get rid of whatever it can. It does not want to process any more alcohol that's in the stomach. So it's just trying to get rid of it as fast as possible. So that's the P.
And I would say really quickly there, again, I think a lot of people who drink too much will end up puking. So we don't want to be like every time somebody pukes, rush them to the hospital.
Right.
This is more of an uncontrollable, almost passed out while puking, can't stop vomiting. This is like next level puking.
Yeah, that uncontrollable puking, especially, maybe sometimes people puke one time and then like I feel better and they're like, okay, I'm good, right? But this is that repeated puking where your body is like in a panic mode, like let's not process anything else. Let's try to get rid of what has just sunk into our system. So that's the P, and the U is unresponsive. So unresponsive, means, you can't be woken up, right? You are unresponsive. So that's the P for puking, U for unresponsive, and then the R is respiration. So if respiration is slow, so fewer than 8 breaths per minute, that is definitely a sign to call 911 and, immediately. And then the S is for skin. So that, if the skin is pale, blue, or cold, essentially this means that there's a lack of oxygen and basically the body temperature is dangerously low. So the acronym is supposed to give you a reminder if actually any one of these things is occurring, that's when you call 911. It doesn't have to be you need to have two of these to call, you need to have three. It's really if any one of these are occurring, you should call. But I'm glad you mentioned the puking because yeah, sometimes people they throw up and they're like, oh, okay, I'm good now. Right. But if they can't stop puking, that is definitely a sign to call 911 or go to the emergency room and you have alcohol poisoning. And so, yeah, that's P.U.R.S.
So Tom, let's talk about some statistics as far as like overdose and
Yeah.
mortality. Like, let's talk about that because again, I think alcohol is kind of swept under the rug as far as how dangerous it actually is, how
Yeah.
frequent people are suffering from it, and that type of thing.
It's this is pretty shocking. So the CDC confirms that excessive alcohol use is responsible for approximately 140,000 deaths in the US each year. Let that sink in. 140,000 deaths each year. And it's estimated that 6 people die from alcohol poisoning every day in the United States. And yeah, many of these deaths happen when friends or family members mistake the symptom of poisoning for severe drunkenness. So, yeah, that's why it's really important to remember that acronym and those specific symptoms. Another kind of important note that I think we wanted to highlight with younger people, the dangers for younger people. So, statistics are particularly alarming for younger age groups. So those that are 35 to 65 have the highest number of alcohol poisoning deaths overall. Almost 2/3 of binge drinkers aged 12 to 20 consuming 5 drinks or more in one sitting is pretty shocking, right? So the risk behavior contributes to significant numbers of emergency room visits.
The ones
So
that
those,
actually go, I
yeah,
think
the
there's
ones that
probably an
actually go.
element of ones that don't go when they actually need the help because they don't want to get in trouble. They don't their friends don't want to get in trouble. So I would imagine that number is probably even higher just based off a lot of people probably won't get the help they need when they need it.
Yeah, no one, when you're young, you don't want to get in trouble. You don't want, the you don't want them to call your parents. You're out drinking, and it's particularly that adds a layer of danger to the situation, right? There's that whole what should we do, to try to get out of getting in trouble, right? No one wants to get in trouble. So I'm sure there's unfortunately been a lot of people that have been very, very close to death or have, passed away from a situation like that. And we've seen it in the movies before, and it's definitely a reality.
Yeah, and I would say, especially that demographic that you mentioned, the 14 to 20 or 12 to 20, it's even higher because that's where, these are kids that are going to parties for the first time. They're going to college for the first time. They're out and about exploring life without parents. They're underage. They shouldn't be drinking to begin with. So I think this is probably a really dangerous period of time for people who are testing boundaries and limits and not knowing. And again, back to the friends, not knowing, does this person need help, or just roll them over, make sure they don't like throw up and pass up in their own throw up. Like there's not a lot of education on how dangerous it actually is if it's gone untreated.
Yeah, I can just recall situations where, yeah, people were unresponsive, and then, everyone wants to be, oh, they'll be fine, right?
Mhm.
They'll be fine. And yeah, sometimes they're not. And so, yeah, remembering that acronym could really save somebody's life.
Yeah. Well, and I would say, just to add another layer of
Mhm.
potential dangers is a lot of times people aren't just drinking.
Yeah.
There is other substances involved, even if it's quote unquote just weed, or maybe it's, some Xanax or, something else. When there is the mixing of alcohol, so
Mhm.
alcohol being a depressant, then throw in some type of drug, I think it will exponentially exasperate the poisoning or the bad effects because it's slowing down your heart rate so much, amongst other things, that the potential for danger there is unlimited.
Yeah, it drastically compounds the danger, right? And so, yeah, alcohol with opiates and benzodiazepines, so like Xanax, Klonopin, Valium, Ativan. So that and opiates, so people using fentanyl, it could be just Vicodin or Percocet. So mixing alcohol with those drugs is very lethal, and it's something to not play around with. So both alcohol and those drugs are central nervous system depressants, and when you take them together, it essentially, yeah, multiplies the sedative effects. Right. And so some people like to do that because, yeah, it multiplies the sedative effects. So they're even getting more high, they're getting more messed up. But it's, you're nearing respiratory failure when you get into that state. And so a significant percentage of drug overdoses involve alcohol. So, it really, yeah, compounds and, pushes those limits and puts people in a really, really bad spot. And then also another combination of risk of mixing substances is alcohol and stimulants. So mixing alcohol with stimulants, tricks you into feeling less intoxicated.
Mm.
So if you're, using like Adderall or meth or, cocaine, you continue to drink, right, past your safe limit. So, I mean, if anyone's experienced that before, you often hear people talk about that when they, if they use cocaine, oh yeah, I can just drink all night long. But it's not that you can drink all night long. It's just that you're pushing yourself past these certain symptoms that would normally make you stop drinking, but your body still has to process all that alcohol. So it still has to, your alcohol blood levels essentially are still very, very high, even though you're able to function. So that can lead to, yeah, fatal alcohol poisoning, also cardiac events, and also a very dangerous dehydration from mixing those substances.
I would say you probably hit a lot of like intoxicated driving under that, because you have the stimulant saying you're fine to drive, but you have all the alcohol that you've drank. And I can only imagine if you get behind the wheel under the influence of any of that, any alcohol of anything, but add in all this other stuff, it just makes you twice as dangerous on the road to yourself and others.
Yeah.
10 times as dangerous, 100 times. I mean, It's just not a good combination, especially if you feel like you're fine, but you're still getting behind a wheel and driving.
Yeah, mixing alcohol with any drug is a really bad idea. It's obviously it gets you more messed up, and that's why people do it, but there's dangers that are often overlooked for sure.
Well, and I think there's a lot of people on prescription medications that don't even
Oh
conceive
yeah.
of it as an issue.
Yeah,
Yeah,
that's a
I
good
take my
point.
Ambien at night, or yeah, I take my Adderall in the morning, and I have a few drinks after work, like no big deal. There
Mm.
is, I think, perhaps some usage that goes on without people even realizing the dangers of mixing all those together. That's why there's always warnings on labels. Doesn't mean everybody leads them, because there's so many warnings on everything. You just kind of become blind to all the warnings, because it's like
Yeah,
everything has warnings, so nothing has
right.
warnings. So I think that you can hit deadly combinations because of that, and unintentionally just doing your normal medications and having a few drinks with the friends.
That's a good point. Yeah, the mixing of medications. Yeah, something that's prescribed. Just because it's prescribed doesn't mean you're in the clear when you mix alcohol with it. And it could put you into, yeah, even more danger, just like we were talking about.
So Tom, let's talk about, and this is one of those cases, and we talk about this often, but if somebody's been habitually drinking, say binge drinking or drinking daily or drinking frequently, it's actually quite dangerous to just quit cold turkey. Like, that is not a recommendation that we do. I think back to way back in the day when I first started doing this 30 years ago, we would detox people without medication, and that is not at all what should be done. That is not medically safe. Nobody should quit cold turkey if there is a point where it's becoming like daily or excessive. And it's hard to know that point until you quit drinking and start suffering from detox from alcohol symptoms.
Yeah, absolutely. Yeah. So alcohol, alters your brain chemistry. And so when you remove alcohol suddenly, the brain is in this overexcited state, and it's leading to this hyper excitability, which results in seizures and also a medical emergency known as delirium tremens or DTs.
Mhm.
So yeah, so it's like you take something away and your body springs back the other way dramatically, right? And it's kind of like with opiates, if you uh opiates make you really sleepy, right? And so you can sleep really good if you take opiates, but if you take them away, you can't sleep at all. You can't sleep at all for weeks. And so it's similar, like your body just snaps back in one way. And so there's seizure risk. It's very dangerous to come off of alcohol, especially if you have been, if you have prolonged drinking, if you're drinking every day, especially as you get older, the seizure risk actually increases. And so it even becomes more and more dangerous. And these seizures can be, they can be fatal. So, alcohol seizures can occur within the first 6 to 48 hours. And, like the risk of death from withdrawal seizures is a concern. Mortality rates for delirium tremens remain between about 5 to 15% without immediate medical intervention. And these deaths are often related to cardiac events or yeah, seizure complications. So yeah, there's big changes in blood pressure. A lot of the systems in your body really get out of whack when you take away alcohol and you had been using it for a long period of time. The DTs are, yeah, a severe form of withdrawal, and it's somebody that's experiencing DTs. It's not just the shakes; it's like being very confused. It's actually seeing things, like those really, really heavy tremors that you see with people, fevers, and yeah, it's a medical emergency, and it requires like constant monitoring and medications to prevent, any death. And one more thing is, yeah, the high blood pressure, right? So, untreated withdrawal puts dangerous strain on your cardiovascular system. So, like I was saying, alcohol, can really calm you down, almost bring your blood pressure down. And then when you take it away, everything just gets out of whack and your blood pressure rises dramatically.
Yeah, I would add in there, you mentioned on it, you see things, but we've seen that quite a bit, like
Yeah.
full-blown hallucinations for long periods of time, even after they haven't drank, even after medical detox. There is long-term prolonged effects that can occur from drinking. And
Mhm.
I was always, not always, but I remember being surprised when I saw somebody who was having full-blown hallucinations, and we're rechecking their records. We're like, wait, did they take meth? Like, what is causing these hallucinations? But it is from alcohol, which is something that you don't hear about very often.
Yeah.
And so just more things to be aware of. And I would like to say that this is not don't stop drinking, or on your own. Like, we want everybody to quit drinking, but we just want you to be able to do it in a safe and controlled environment where you're being monitored by a physician. You have people there looking out for you. You're coming down safely. There's support all around you. Like, doing it on your own or cold turkey is really it can be kind of dangerous.
Yeah, absolutely. And I just want to add one little thing there. Yeah. Uh, because alcohol is such a sedative, and if you're a lot of people want everyone in their life to drink less or stop drinking, but if you know somebody that's especially drinking every day, and you just want them to stop, you have to really consider they need to be removed from their life, like the stresses of their life, right? So if somebody is trying to quit alcohol and they're going to work every day, they're having to deal with work stress, or they have kids, and their kids are maybe young, that could put them in a situation where they could be at cardiac risk. So you just really want to think, like, be mindful of the person, the setting that they're trying to detox in, and not pushing someone to just get better, just stop drinking. Like, there's dangers here, and so you need to be mindful of that, and help kind of make a plan to get them in a safe environment so they can, like, come off alcohol safely.
And I'd like to mention, like, we talked about the physical part of detoxing from alcohol and the physical symptoms, but obviously, like with any addiction, there's a whole lot more that goes into it spiritually, emotionally, that people need to address, because it's the most in your face kind of drug. Like, someone could quit doing crack by avoiding that ghetto area town that they go get their crack. I mean, their urge will go there, but if they reroute their things and redo their day, they can easily avoid that. However, alcohol is everywhere. It's at every celebration. It's at every sad thing. It's with dinner. It's, you name it. There's always a reason. And there's liquor stores on every corner, and there's grocery stores with like aisles and aisles and aisles of alcohol. So it is almost like food. It's like really impossible to avoid it altogether. So there has to be more work that goes into it besides just handling the physical aspect. We got to get in there and get to the root, and what started this? When did this become a solution? How can we curtail that and put in some healthy habits to help you avoid that as a solution, and put in new things that are healthier and better for you, and that type of thing.
Yeah, there's a lot more that needs to be done besides just detox, right? And it's I'm glad you mentioned that. But that's definitely the first step in a lot of cases. Some people, um, you know, need detox, and they can go to support groups, but we would recommend they do a program like ours, of course, to, like, really, really make sure that you don't go back to that behavior, and understand on a deeper level of why you started drinking like that in the first place. And sometimes that's not just an easy A to B thing. There's lots of layers to us. So yeah, I'm
Yeah.
glad you mentioned that.
Yeah. And one last thing I want to add here is, age is not a deterrent. Like, I've seen more young people come into the program over the last 4 years than I ever recall seeing. And their primary drug of choice was alcohol. And for a lot of people, a lot of them, that's all they were doing is, quote unquote, just drinking. So I think for a lot of us, we consider, oh, if you're an alcoholic or you have alcoholism, you must be older. That is sort of like the assumption, but we're seeing it younger and younger and younger. So don't think just because you're person you love is young or they're only 20, that doesn't mean that they can't have this serious of a situation that needs handling. And better to get it handled or get them in control of this addiction earlier than later. But young people are not off limits when it comes to seeing the alcohol poisoning, but also the detriments to their physicality and emotionality at a younger age.
Yeah, I agree. And just to go over the acronym with everyone one more time so you don't forget, it's P.U.R.S. So the P is for puking, the U is for unresponsive, the R is for respiration, so slow breathing, fewer than 8 breaths per minute. And then the S is for skin, so skin that is pale, blue, or cold. And, hopefully having this podcast or listening to it, could save somebody's life. And, we want to make sure that we're giving good information out there. And, if somebody ever needs treatment, we are professionals. We're here to help. And just give us a call. You'll talk to somebody that really cares and that will walk you through the correct steps to take. Okay.
All right. Well, thank you for coming back to the show. And I'm excited to see what our next topic will be. And if anybody has anything they need or want to hear from us, from our viewpoint, what we see, what we know, we'd be happy to do a podcast or help on that subject as well.
Yeah, just put it in the comments and we'll definitely see it. Thank you.
All right. Awesome. Thanks, Tom.